Let's take a look on all the types of diabetes. There are four main types of diabetes which occurs most commonly in patients. These are type 1 diabetes, type 2 diabetes, prediabetes, gestational diabetes. Type 1 diabetes is an autoimmune state in which body attacks itself. In this type, insulin-producing cells in pancreas are destroyed. Diabetes. It is commonly occurs in children and young adults. Up to 10 of people who have diabetes have type 1. It is also known as juvenile diabetes. People with type 1 diabetes need to take insulin every day. This is why it is also called insulin-dependent diabetes. In type 2 diabetes, body either doesn't make enough insulin or body cells don't respond normally to the insulin. This is the most common type of diabetes. Up to 95 of people with diabetes have type 2. It usually occurs in middle-aged and older people. Other common names for type 2 include adult-onset diabetes and insulin-resistant diabetes. Prediabetes is the condition in which blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetes. It is the pre-stage of type 2 diabetes. As it prolongs, it can cause type 2 diabetes. In gestational diabetes, woman suffers usually in their pregnancy. It usually vanishes after pregnancy or having a baby. Gestational diabetes can easily control with taking less glucose and sugar in the pregnancy. Is usual state nowadays. If you have gestational diabetes, you're at higher risk of developing type 2 diabetes later on in life. Less common types of diabetes include monogenic diabetes syndromes. These are rare inherited forms of diabetes accounting for up to 4 of all cases. Examples are neonatal diabetes and maturity onset diabetes of the young. Cystic fibrosis-related diabetes. This is a form of diabetes specific to people with the disease cystic fibrosis. Drug or chemical-induced diabetes. Examples of this type happen after organ transplant, following AIDS treatment, or associated with glucocorticoid steroid use. Diabetes insipidus is a distinct rare condition that causes your kidneys to produce a large amount of urine. Do subscribe for taking more information on medical topics. Stay tuned and subscribe our YouTube channel.